My name is Adelina Comas-Herrera, and I'm a researcher at the Care Policy and Evaluation Center at the London School of Economics. Today I'll be talking to you about COVID-19 and its impact on older people. So I'd like to first of all acknowledge all the people who have contributed to reports through the LTC COVID website, including my co-authors in some of the reports I'll be showing. The LTCCovid.org initiative was a spontaneous international collaboration to share learning on COVID-19 and long-term care. It has a number of international reports, country reports, and as well as a collection of resources, summaries of emerging evidence, and a directory of research projects. And it welcomes additional contributions and volunteers. We're all learning from each other at this crucial time. First of all, just as we know, COVID-19 affects older people much more. They have a much higher probability of dying if they are infected through COVID. And I'm showing here this graph that shows that compared to the average rate of mortality in the countries, the people aged 65 and over, particularly men, have a much higher probability of dying across all countries. You will notice that there's one country that looks a bit different with an even higher rate, that is Brazil. I'm not entirely sure what the difference is due, but all the other countries that are listed here are high-income countries, except for Brazil, and it might be that that has something to do with it. The source of this document is a recent study by Yanev et al. So knowing that older people are more at risk, it may not be such a surprise that we have found that a large number of the deaths linked to COVID have happened among care home residents, among people living in care facilities. And this is a contrast, the fact that we have, at least for high-income countries, just about half of all deaths in care homes, when only 0.75 on average of the population are living in those care homes. So why has there been such a large impact on this care home population? And there are some potential explanations that I'm just briefly going to mention. Some of it is because of the high risk of the population. As we said, they are older. This virus affects more older people, but they also live in crowded living conditions. They live in a congregate setting, and that means that it's very difficult to apply any kind of isolation. And they also, in large numbers of the people living in care homes, need close contact care. So they'll rely on personal care provided by somebody who has to be close to them to provide it. But we've also seen that there have been a lot of problems with the policy responses, particularly in the first waves of the virus, with late and insufficient access to testing and personal protection equipment in care homes, late adaptation of guidance to recognize the geriatric COVID symptoms such as delirium, and also the possibility of asymptomatic transmission. We've also seen examples of reduced access to healthcare. We have found that there's a very high correlation in the deaths happening in care homes and the deaths happening outside in care homes if you look at the shares of the population. And that's telling us that the measures, particularly we adopted in the first wave, didn't really help that much in terms of protecting those living in care homes from having the disease and then dying. But we also know that COVID-19 has affected very severely people relying on care who live in the community. So we know that they've been using less formal care services, and that will be because of less availability of service or the need to quarantine. We know that informal and formal cares were often not recognized as key workers. And we know that there's been a lot more burden and stress and financial strain for unpaid carers. And we also know that there have been a lot of deaths happening in homes that may not have even been recorded as COVID, and these may have been due to people having care needs. And in fact, a lot of this excess mortality has been happening among people who have dementia. So what have we learned? There's a really good World Health Organization policy brief setting out lessons from initial lessons for a number of countries. And we know that there is some hope. So we know now much more how important it is to develop emergency responses that take account of older people and people with disabilities. We know that there's a bit less mortality in care homes in the second wave in some European countries. So maybe some of the things we have learned have been put into practice and have been successful. And of course, in many countries, we now see a prioritization of people living in care homes for vaccines. And I think a consensus is emerging on the need to modernize care systems so that we can strengthen community-based care. Thank you very much.